Good morning, everyone. My name is Monica. I'm your lead public health preparedness trainer. Today, we are going to talk about an infectious threat that is particularly important in healthcare settings, which is known as methicillin-resistant Staphylococcus aureus, commonly known as MRSA. By the end of this session, you will know what it is, who are at risk, when it spreads, and most importantly, how can we protect ourselves, our patients, and our community. Let's talk about MRSA, exactly what it is. So, it is a type of Staphylococcus bacteria that has become resistant to methicillin, which is a drug which used to cure Staphylococcus infections and many other antibiotics we normally use. That resistant mean infections are harder to treat and easy to spread. MRSA can cause everything from skin infections to pneumonia, bloodstream infections, and even life-threatening sepsis. Risk factor includes poor hygiene, crowded environment, frequent antibiotic use, and recent hospitalization. Let's talk about who is most susceptible to these kind of infections. MRSA does not discriminate, but some groups are more vulnerable than others. Patients with open wounds, surgical sites, or catheters are at higher risk, as well as those with weakened immune systems. Healthcare workers can pick it up from contaminated surfaces and outside the clinic. Athletes, children in daycare, and even military personnel can be affected. In our clinic, patients with chronic wounds or recent surgeries are ones we need to watch more closely. Let's talk about where the testing should be done. The testing should be happen the testing should happen right here in the clinic. If MRSA is suspected, we use nasal swabs to check for colonization, wound culture for skin or surgical infections. And the blood test, if the patient shows systemic symptoms, it is most commonly used. The key is early detection. If someone has a suspicious skin infection or a lesion or a known history of MRSA, test immediately. When are they contagious? One important point is that MRSA carriers can spread the bacteria even without symptoms. When are they contagious? One important point is that MRSA carriers can spread the bacteria even without symptoms. As soon as the bacteria colonize the skin or mucosa membranes, transmission becomes possible. That's why contact precautions, especially hand hygiene and surface disinfection, are non-negotiable in prevent of this disease. Why is MRSA important to us? Why should we be concerned? Because MRSA has both a personal and a community impact. It can increase hospital stays, raise healthcare costs, and because of antibiotic resistance, it's much harder to treat than other infections. If protocols are not followed, it can spread quickly through a clinic and beyond. Our responsibility is to prevent outbreaks before they start. How do we protect our staff and patients? So, how do we protect them in the clinical setting? MRSA spreads primarily through direct contact. That means gloves and gowns for patient care, through hand washing before and after contact, and strict surface disinfection using EPA approved agents after visit. Patients with active MRSA infections may need to be placed in isolation. These steps must be followed consistently every single time. With the right systems in place, MRSA is preventable. Thank you all for your time and attention today. MRSA is a serious challenge, but one can manage with knowledge, vigilance, and consistent actions. Let's stay prepared, stay clean, and stay safe for ourselves, our patients, and our community. Thank you.